So we are going to be continuing just the other part of this part 3 of our talk this morning. We're talking about the secrets of the healthiest people in the world. We look at the genetic factor we saw this morning. We saw that genes play a big part of it. We looked at certain telomeres and the work of the DNA. Environmental factors, things that can impact on your health, some of which we don't have entire control over. For example, we know that our field is now being surrounded by electromagnetic fields. Large numbers. We have satellite dishes that are covering the globe. And we are not sure what the effect of the electromagnetic fields are. Not entirely. Our bodies are electromagnetic. Your heart, your brain, every muscle, every cell of our body is electromagnetically charged. And we can determine that. An ECG, electrocardiogram, is the electromagnetic signature of the heart. The EEG, electroencephalogram, the electromagnetic signature of the brain, and so on. We're even using magnetic fields to treat medical conditions called TMS. Transcranial magnetic therapy, and you can put a magnetic fields over the brain, the head, and by applying magnetic fields, large strong magnetic fields, we're able to alter disease conditions and chemical balances and imbalances in the brain. So I have no doubt at all that there is a great impact of environmental factors on our health. Even the water we drink is polluted in some ways. We drink water from water bottles, and there's dioxin. The soft bottles leach chemicals into the water. The drinks that we drink, the soft drinks, the fruit drinks, and so on. We drink them, but we're not sure what we are drinking. I suppose you can use a quote from the Apostle Paul: "We eat and drink to our damnation." I know it's a different context. Don't get me wrong. I understand that. But it would be true to say that when we eat some of these foods today, we're eating and drinking to our damnation. And the trouble is that in many instances, we don't even know what we're eating and drinking. So that sometimes when we get health, it's not a deliberate decision or bad decision we've made. Sometimes it's just that things are happening around us over which we don't know, and neither do we have any control. So we've looked at genetics. We've said genetics plays a part. We've looked at environmental factors. We've just said that there are a number of environmental factors all around us that we have no control over and that can impact on our health. Now we want to look at the dietary factors, because dietary factors play a very large part of our health, and those to some degree we do have control over. So the nutrients that we eat impact on our aging. It's extensively studied in all forms of animals. I myself did, when I was doing my own research at university, I studied into animal health and animal husbandry and the impact of nutrients on health. So a healthy diet and healthy eating makes a big difference. There is a connection between the nutrients that you eat, nutrient energy intake, and aging. And that's been done with a number of elegant studies looking at rats, and they do what's called calorie restriction. Calorie restriction, where they reduce the amount of food that the animal is eaten, sometimes 30 to 40%. And they've shown in a number of these studies that as you get older, by restricting your calorie intake, you can extend the maximal lifespan of the animal. And it's been done in not just rats. It's been done in monkeys, and a number of studies that have been done all confirm a very, very, very strong scientific point that limiting carbohydrates, proteins, and fats from the ad libitum, meaning you take it whenever I'm hungry, I eat it kind of thing, to a restricted calorie energy food does in fact extend your life. And the message really is, as you get older, you should be eating less calories. Now, that does not mean that you're not making and paying attention to your nutrient intake. There's a difference between your calorie intake and your nutrient intake. You still need to have a very high nutrient intake as you're getting older. As a matter of fact, it's probably even more important to ensure their nutrient intake is up to date, because you don't have the reserve. As you get older, your reserve slacks. You get less and less ability to compensate because we don't have the reserve. And so just to make sure everybody understands the difference between calorie-rich and nutrient-rich. Let us take something like a chocolate bar. A chocolate bar, one of the normal sugar bars that you buy, or donut, for example, any of those. That's calorie-rich but nutrient-poor. I hope that makes sense to you. It's calorie-rich. It has a lot of calories in it, but it doesn't have a much nutrient. You know, a chocolate bar that you buy has very little nutrients in it. It's a lot of sugar. On the other hand, if you take something like a celery stick or a carrot stick, those are nutrient dense but calorie poor. So they have very little sugar, calories, but they're very high in nutrients. So the message is, as you get older, you want to reduce the amount of calories you're taking, but you want to make sure that you have a good quantity of nutrients, minerals and vitamins, because those are important for metabolic processes. And as a general rule, that's what we found in studies with the animal studies have confirmed that. So calorie-rich restriction improves health span in lab animals. It increases their memory, it increases their muscle mass, mitochondrial function. The mitochondria are the little powerhouses for each cell. And a lot of sickness is related to mitochondrial dysfunction, that the mitochondria are not working. And there are reasons for that. You have to look at mitochondrial supports and so on. The other thing is insulin sensitivity. So the more sensitive your insulin is, the more it is able to respond to blood sugar. So insulin resistance is the opposite of insulin sensitive. Diabetics are insulin resistant. So that they may have a supply of insulin in the body, but the insulin does not respond to the sugar. So it's said to be insulin resistant. But by fasting or a calorie restriction, fasting is just one form of calorie restriction, you're able to improve the insulin sensitivity so that your insulin is much more effective in dealing with sugar. So memory, importance in memory, muscle, mitochondrial function, and insulin sensitivity have all been shown to improve with calorie restriction. On the other hand, when you give an animal ad lib feed, he eats whenever he wants to eat, you have the reverse. We see incidences of cancer, worsening renal disease, autoimmune diseases, Alzheimer's, atherosclerosis, and sarcopenia. That's muscle weakness. All of those related to, ad lib eating. So the whole concept of ad lib eating is not necessarily one, as you get older, is a good plan. Certainly not a good plan. And certainly as you get older, you don't want to be eating the high calorie foods, or consuming high calorie foods, a lot of chocolates and ice cream and candy bars and all the things that we do. Whereas when you're younger, they can compensate. A young person could eat all of that and they'd be fine, in the sense that they don't suffer. They don't put on a pound. If I eat a chocolate bar, I'll be putting on pounds while I'm eating this stupid thing, so that we just don't compensate as well for it. So that's calorie restriction, and if you look at calorie restriction in terms of its benefits and so on, so it can be good in terms of lowering disease and all that sort of thing, and longer life. But you have to be careful of not being severe, because severe calorie restriction has its dangers as well. So severe calorie restriction would have been seen, for example, in prisoners of war. They put them in the jails, or they put them in the war barracks and so on, and they would restrict them. And as a result of that, these people had all sorts of problems. But what was interesting? They looked at the war veterans who came from World War II, who were put in Japanese camps. And it turned out that they had less incidences of atherosclerosis, less incidences of cancer, and their general health was much better than people who were not prisoners of war. So there you have it. There you have it. But that being said, severe calorie restriction has its dangers, and we don't teach or recommend severe calorie restriction. An example of somebody who's really gone severe is somebody who's got anorexia. Yes, thank you, Dan. Anorexia nervosa. Severe anorexics. So they'd be bone thin, and that's really not a good state of health either. So there's problems with severe calorie restrictions, and the trouble with calorie restriction when it's severe is that you also restrict your nutrients. It's not just calorie restriction in severity; it's nutrient restriction. So we just need to get a proper balance right. So there are some diets that will mimic this fasting. These are diet mimicking periods of fasting or fasting calorie restriction. So you want to restrict calories. You have different ways you can approach it. That's the best way to put it. Different ways you can approach it. Well, fasting is one way, and you can do the low calorie intake by up to 30 to 50% of your normal calorie foods. Now your normal calories is about 3,000 kilocalories per day. So you can cut that back to half that, 750 to 1,000 kilocalories per day. 10% protein, 50%, 30 to 40% carbs, 40 to 50% fats. Now that's healthy fats, and I'll talk about that in a minute. And you do that for 3 to 4 days, and after 5 days you can eat your normal diet, and you do that on a 25-day cycle. So basically you fast, you eat 2 meals a day would probably be the best way to put it. Instead of 3 meals a day, you eat 2 meals a day for 5 days a week, and you repeat the cycle, every 25 days, every week, and you take a break every 25 days. They're all different ways. People talk about the 3 and 1, the 4 and 2, the 5 and 2, and they have all these different things that they're trying to. Everybody coming up with a new idea. It doesn't really matter, to be perfectly honest. It's a fasting, and if you understand the principle, then when people come up with all these 5 and 2, 3 and 4, 4 and 6, 9 and 2, 9 and 8, and all this type of things, you're like, hang on, guys, this is just simple fasting. It's nothing fancy. I don't have to pay a whole lot of money for that. It's just a fasting period. A simple skipping 1 meal a day would give you 30% reduction. So that schedule I've just put out there can be achieved simply by skipping 1 meal a day. So instead of eating 3 meals a day, you eat 2 meals a day, and you'd get 30% reduction in your food, your calories. Very simple. So there are ways to do it, and those are called fasting mimicking diets. So it's just fasting is all you're doing. And when people follow those diets, they've shown a low incidence or reduction in diabetes, cardiovascular disease, cancer, and potentially aging. You know what I mean? Because aging is a process of burning up. If you hypermetabolize, you burn up, and you age. So we talk about things like reactive oxygen species. So your body is burning up. It's over metabolizing toxins. Reactive oxygen species is what gives you the aging. So the less toxins you put in your body, the less toxins you have to metabolize, which means you don't age as quickly. So what about micronutrients? So we talk about fasting. We say you can mimic calorie restriction by fasting. What about micronutrients or small molecules that we can put in the diet that might mimic this calorie restricting diet? Well, the answer is yes. There are 3 things that we know can do it. There's antioxidants and phytonutrients or phytochemicals. There are anti-inflammatory compounds, and there are drugs and small molecules. So you can create or mimic the same effect by taking these or combinations of them as well. So what are the antioxidants? So we said antioxidants. So there they are again, antioxidants, anti-inflammatories, and certain drugs and small molecules. So what are the antioxidants? The vitamin E, vitamin C, vitamin A, C, and E. Those are the major ones. Glutathione, coenzyme Q10. So those are the major ones that are involved in the antioxidant. Then people talk about the role of zinc as an antioxidant as well. And so there is evidence that using these supplements can help, particularly if they're better in the natural state. Because a supplement, an antioxidant supplement, is not the same as a phytonutrient you find in plants. Phytonutrients found in plants have a ways of compounding themselves. They're really mixed up with protein bases, lipids and phospholipids, and they surround the antioxidant with a lipid base or a lipid soluble base. That being said, if you can't get that in supply, then take the supplement is not a bad idea. And I use vitamin C every day as well. Coenzyme Q10 is a very good supplement. It's a bit expensive, but it's a good supplement, and we use that as well. So those are calorie restriction mimetics, the antioxidants. What about other mimetics? Calorie restriction, fewer calories, mild transient cellular stress, and the result of that is increasing repair. What was it doing? It increases your repair. So the body so one of the questions I get asked a lot is what is this advantage of doing these calorie restrictions? Well, the reason is that your body needs time to repair. So in your whole system, one of the things I would also promise to do is sleep. Your body needs a period of repair, rest and repair. It's not the same thing. It's not the same thing. Your body needs to rest and your body needs to repair. That's two different processes. If you're eating all the time, you're not giving your gastrointestinal tract time to rest. So it's always working. It's always having to metabolize something. It has to churn up food. It has to provide enzymes and so on. When you give your body time to rest, the body has to go through what's called a repair cycle. So it has to repair. And there are things that you can do to assist the repair cycle. In terms of even when you eat food, and I'll talk about that shortly, the timing of your eating of food influences your repair cycle. Sometimes called the cycle of the flux versus the fixed cycles. So you need to have time to give the body time to rest and give the body time to repair. And we've shown that if you do that, you get that balance right, the repair and rest, you get optimum mental, cardiovascular, neuromuscular, and immune function, because your immune system can't be you can't have your immune system constantly activated. It's not a good plan. It's not a good strategy, because your system goes into overdrive. It never gets a chance to heal. So micronutrients can help with cellular loss, with cellular repair, and it can help with antioxidant support. Now, so there's a lot of candidates have been put forward as the small molecules. What small molecules can you use to support as a mimetic and to support the health span? And a lot of them have been put forward. There are over 600 of them. There are some which I've put for your information. On this side, chocolate and coffee. Now, I know that sounds like a little strange for the conversation we would normally have in our context, because we talk about coffee and chocolate being bad, and that is true as a general rule. But we're not discussing the sort of that normal coffee. But there is no question that the coffee contains, both chocolate and coffee contain elements in them which have been shown to protect the immune system and protect the body. Now, the problem with it is how they prepare the coffees, the extraction processes and the caffeine. But there are agents in both chocolate and coffee which have been proven to be protective. Now, that makes sense to me, because I can't see that God would make something that would hurt you. That just does not compute with my way of thinking. Why would God do that? So I don't recommend coffee drinking and chocolate eating, like how I said before. The way they prepare chocolate bars and the way the coffee bars and so on. I'm not. Please don't think I'm suggesting that at all. But I'm saying there are the caffeinated brands, special brands of caffeinated brands of coffee and chocolate. They have dark chocolate and so on that are very healthy. That just happens to be the facts. Berries, there are all different sorts of berries that have been shown to be useful. Sometimes we buy here super berry. It contains all types of blueberries, raspberries, goji berries, strawberries and so on. All these berries have been shown to be very good antioxidants and phytochemicals. On this side is red wine. Now, I have to talk about that, shouldn't I? Yeah. Because there is evidence that red wine contains nutrients in it that will promote healing. Now, I hasten to add, because I've done the studies on this one, it's not the alcohol that's doing it. No siree. There's no siree. No scientist believes that. The so-called French paradox is very evident. The alcohol is harmful. Alcohol is a toxin. It's a preservative. So there is no way you could suggest taking alcohol as being beneficial to your health. There's no way you could support that. But that being said, there is evidence that the extract of the alcohol, which is the resveratrol, which you initially used to get from grapes, the skin of the red grape, but there are a number of plants now, they use algae. The Japanese algae are used for large production of resveratrol. They don't have enough skin of red grapes to produce resveratrol. But you get it from multiple other plants, including algae and so on. And they are very helpful. And I take resveratrol every day. I can tell the difference. When I don't take resveratrol, I can tell the difference in my performance. It's that acute. In my own body, I can tell. So resveratrol you can buy and you can use that. And I would certainly, of the things that we're discussing here, I would certainly recommend resveratrol for you very strongly. Very strongly. There's a number of scientists that have been looking at aging. And one of the things they looked at was the use of resveratrol. And they also looked at the role of a certain formula of vitamin B, vitamin B2. So, in terms of the aging process. And there's some other things which I'll show you. Then on the other hand, there's things like the sulfur-containing brassica groups. So that'll be Brussels cabbage, cauliflower, Brussels sprouts, and the onions as well, garlic and onions. And those have a lot of sulfur-containing nutrients or phytonutrients that have been shown to protect you against cancer. So that's a very good group to be used. And again, I anything I tell you, I do. I don't say these things because I have nothing else to say. And I use a lot of the cabbage and a lot of the onions because of its sulfur-containing phytonutrients. Very good. Now, so those are the sort of common things that you can buy and get off the shelf without having to ask anybody any permission. Now, there are two others which I'd mention here: rapamycin and metformin. Rapamycin is an antibiotic. It's an antibiotic really, and it's not available for normal use, but it has been shown to increase the lifespan of animals, the experimental animals and so on. You can use rapamycin, and it's very good for increasing muscle mass. They've shown that if you give an elderly rat, and rats show the same health features we do. They lose their muscle mass, they lose their memory, they can't find their way around the maze, they lose their digestive abilities and so on, they lose their hair. There's no difference, you check their hormone levels are low. It's just like a normal person in terms of the process is there, the same. If you give rapamycin to an elderly rat, within 3 months that elderly rat regains his muscle strength, he regains his hormonal status, he regains his memory, and they said when you compare his function, it is that of a young person. So whether that's the call to the function of youth, but it's not one of those drugs you take, and it's a mycin group. It's used in antimitotics or cancer things. The other one that they've been looking at is metformin. Metformin is used in diabetes, but they've shown that metformin reduces reactive oxygen species, which is intrinsic in the injury to the cell. And so even though diabetics on one hand, because they're combating the high sugar and the issues with high sugar, they're protected from cancers. So they have a low incidence of certain types of cancers if they're on metformin. So again, it's one of those things, and it's not something you can just go and buy. It is pharmaceutical. All right. So here are just some vitamins for your optimize. It's called optimum nutrients. Your vitamin B12. Vitamin B. I really ought to mention this in particular. Vitamin B12. There are two vitamins that we're really struggling with. 3. And I've put them up here on the sheet for you. vitamin B12, vitamin C and vitamin D. Now I shouldn't even have to discuss vitamin D, but I need to, because in Australia, with all the sunlight we're having exposed to, there's been shown that Australia is going through an epidemic of vitamin D shortage. Vitamin D is produced by the sun, acting on a metabolite of the of vitamin D in your skin. And yet, despite that, we're seeing shortages. And so a lot of diseases, your immune system is affected. They've shown that people who have a low vitamin D level, they cannot protect themselves against the COVID-19. That's how far this thing has gone. Even against the COVID-19, you can't protect yourself because your immune system is dysfunctional because of the low vitamin D we're seeing in here. People are suffering with rickets. How do you get rickets in Australia? How does that even happen? I don't know, but it's happening. And the other one is vitamin C, because vitamin C is vitamin C has to be taken in from outside. So there are only two animals in the animal kingdom that can't produce vitamin C spontaneously. That's animals and the guinea pig. They can't produce vitamin C. You have to take vitamin C outside. All other animals can take glucose, because glucose is only a molecule away from vitamin C. So some animals, most animals can take glucose and convert it to vitamin C in the body, but humans and guinea pigs can't. So if you don't take vitamin C on the inside, you will develop scurvy. So you have to have a supply of vitamin C. You need at least 100 milligrams of vitamin C a day to maintain optimum health. And that's assuming you have a healthy diet. So you just have to bear in mind, I take vitamin C every day. I take an extra 1,000. I take 1,000 milligrams a day. But that's me. And then the other one is vitamin B12. Now, as you get older, and this is an important point for those who are listening, I'm not sure how many are listening, but whoever is listening, as you get older, your vitamin B12 levels drop. Now, you ask me why. The reason for that is that vitamin B12 is not absorbed directly from the stomach. All of the vitamins are. They're water soluble. Vitamin B is a water soluble vitamin, so it should be absorbed in the stomach. Vitamin B12 is not. And the reason for that is vitamin B12 has to be bound by a factor that's in the stomach called intrinsic factor. And it binds, and that's produced in the stomach. It binds to vitamin B12, not vitamin B, it's only vitamin B12 I'm talking about. It binds to vitamin B12, and it moves down the small intestines, and it's absorbed in the small intestines as the intrinsic factor vitamin B12 combination. So as you get older, two things happen. Your production of intrinsic factor drops. So you're not absorbing as much B12. And because of a medication issue, because a lot of people are put on the H2 antagonists or things for the stomach acid. And all this stomach acid does, it stops the production of stomach acid, but the same cell that produces the stomach acid also produces intrinsic factor. So when you block one, you block the other. And so we're finding more and more people as they get older and a number of all these medications, they're suffering from vitamin B12 deficiency. And that can manifest as nerve pain, peripheral neuropathies, skin changes, hemoglobin problems like anemia, nervous disorders. It can do all sorts of things. So as you get older, you want to be watching your vitamin B12 level. You can get vitamin B sublingual, you can take it under the tongue. You can get injections, a little more painful, but you just need to keep a close eye as you get older on vitamin B12. Okay, so all of that is there. So let's see if we could kind of wrap this up. So what can you do to maximize your health span? Now remember, we said there's lifespan and there's health span. Lifespan, there are factors that sometimes are beyond our control, like our genes. Your health span is also under some genetic control, but it's largely under the influence of diet. So optimum cardiovascular, neuromuscular, and immune function can be achieved if we minimize or eliminate the risk factors, which would be sedentary lifestyle, which is laziness, high blood pressure, obesity, which is eating indiscriminately. That's not the only reason, but it is a factor. Diabetes and smoking. And you promote the things which will encourage, on the other hand, good bodily function and health improvement, like moderate exercise, the mental status, keeping your mind engaged. And they've shown that people who follow things like crossword puzzles and Sudoku and all that sort of thing, people who engage their mind, they have a slow incidence of dementia. So it's use it or lose it. And of course, we talk about the proper use of diet in terms of fruits and vegetables, antioxidants and supplements. So those are the way in which you can maintain and improve your health span. So in conclusions, ladies and gentlemen, it is the interplay of genetics, environmental factors, both positive and negative. So everything is both positive and negative. And your diet that influences your health span. Remember, we're talking about health span versus lifespan. You know, you have that genetic, environmental, dietary interplay. And all of those factors work together in order to ensure that your health improves as the eagle, as the Bible predicts. So that is the largest factor affecting longevity and healthy aging. That is your largest component. Or to put it differently, many of us are digging our graves with our teeth. And it is by a good selection of foods, but in terms of supplements and making sure you understand what you need for your health, which is what I've tried to give you this afternoon. The things that you need for your health. I talk about the antioxidants, which antioxidants are valuable, the vitamin B, the vitamin C, and so on. The only one I'd mention to you here, which is not in this group, but I'll mention it to you, is something called milk thistle. Now, the reason I recommend milk thistle is milk thistle is a herb. The generic name is Silybum marianum. It contains an enzyme. It contains a substance called silymarin, and silymarin is able to help the liver to metabolize properly. So it improves phase 2 conjugation reaction. So your liver has 2 phases, phase 1 and phase 2. Phase 1, all the toxins you eat, all the drugs you take, all the junk we put into ourselves, in our systems, and all the toxins that the body is producing through its normal food eating and metabolism and walking and so on. The liver has to detoxify that, and it does it in two phases. Phase 1 is where it binds it to an oil and makes it to try to make it get it out of circulation. And then phase 1 is where it's phase 1. It tries to bind it out of the system. Phase 2 is where it binds it to make it water soluble. And if we're producing a lot of toxins, you get the overload of phase 1, and then it goes into what's called zero order kinetics. In other words, 1 in, 1 out. 1 molecule in, 1 molecule out, because this system is blocked down. It can't get any more. You've overloaded the system. What milk thistle will do is increase phase 2 conjugation. So it speeds up the outlet so that more toxins can be poured out of the system. So that's the only one I haven't mentioned here, but I mentioned it now for completeness. And I think I've given you all the elements that you need for good health. So, ladies and gentlemen, you're standing at the crossroads. Health is a change of lifestyle. That's the one thing. I can tell you all about calorie restriction. I can tell you about mimicking your diet. I can tell you about reducing the amount of food. I can tell you about supplements. I can tell you about exercise. I can tell you about be careful of all the stuff that you eat that are toxic. I can say all of that. At the end of the day, the choice is yours. The choice is yours. So you have your choice. Either have the rest of your life as a good life, or you can have a memorable life, or you can have an average life. But the choice is yours. All I can do is give you the information. But what you do with it is up to you. And so with that in mind, ladies and gentlemen, my desire for all of us is the words of St. John the Apostle. Beloved, I wish above all things that you would prosper and be in good health, even as your soul prospereth. Thank you very much for your time, and may God bless you.